The CDC has now officially updated the list of symptoms of the coronavirus, adding 6 new possible signs of the disease.
Eyewitness News reporter Courtney Carter spoke to a local doctor and has more details on what you need to look out for.
According to the CDC, initially the most common symptoms of the coronavirus were fever, shortness of breath, and coughing. But doctors say they learn more about the virus every day, and through that have been able to identify new symptoms people should watch out for. The Centers for Disease Control, or CDC, has been able to identify now a total of 10 official symptoms of the virus that researchers and medical experts are still learning about every day. The full list is now chills, repeated shaking with chills, muscle pain, headache, sore throat, fever, new loss of taste or smell, cough, shortness of breath, and difficulty breathing.
Our understanding of this really complex disease continues to evolve, and as physicians caring for people with COVID-19, we've seen that there are typical symptoms, the fever, cough, and shortness of breath, but we've also learned that there are a lot of atypical symptoms as well, and the list of those atypical symptoms is growing nearly day by day at this point.
Dr. Laura Foreman, Chief of Emergency Medicine at Kent Hospital, says medical officials have been seeing the new symptoms for a period of time, but only recently, after seeing more and more patients, could the CDC make it official.
And they've been reported in the medical literature along with a number of other symptoms. So they've added these new ones to the list, I think, because they've become 6 of the more common symptoms, but we've been seeing them for quite some time.
But Dr. Foreman wants to remind you that it's important to remember it may take time to see symptoms at all, typically 2 to 14 days after exposure, and some testing positive are still asymptomatic.
This is a really confounding disease, and in the medical community, we're literally working around the clock trying to better understand it, trying to better understand how to prevent it, how to treat it, how to keep people safe from it.
Now, the CDC recommends that you should take immediate emergency care if you have any of the following symptoms, and those are a bluish tint to your face or mouth area, trouble breathing, pain in the chest, or confusion. I'm Courtney Carter, Eyewitness News.